Hi, this is Dr. Jack Belitz, and welcome to another episode of Ask Dr. Jack. Today we are going to talk about a topic that a lot of people don't understand, and I want to get everybody to do it properly. So we're going to keep this one close to the top so that people can refer to it often and everything like that. And that is icing. Icing is one of the best things that you can do for your body if you have a joint issue, but only if you do it properly. The whole idea of ice is to get the body to get the swelling to move away. So when you apply the ice bag, you want to have either a bag of ice or a gel pack like this that is frozen. Then you want to get it on your body, but you don't want to put it right on your body. You want to get a damp cloth. Now, everybody asked me the first question, what do you mean damp cloth? Why do I have to get my clothes wet? Okay? The reason that it is so important that you use a damp cloth is because if you put the ice bag directly on your skin, you are going to cause the skin to start to freeze. The body's going to pick up on that, and its infinite wisdom, it's going to say, hey, I don't want those skin cells to freeze, so it's going to bring all kinds of blood to that area to overcompensate for the cold so that the skin cells don't freeze. And it's basically going to undo all the good that the icing's supposed to do. Now, if you put a dry cloth or you just put the ice bag over your clothing, well, then all that either that towel or your clothing is going to do is it's going to keep the cold from penetrating to your body. So what you want to do is you want to use a damp cloth. If you use a damp cloth, the moisture of the towel will keep your skin from freezing, but still allow the cold to penetrate. Now, I don't know about any of you. I am a wimp when it comes to icing. I hate cold ice. So what I do is I get the towel nice and warm, even use hot water to moisten it. I wring it out, I put it on top of the ice bag, and I right away put it on my back, wherever it's got to go. And then within 20 seconds, it's already cold, but it's a nice smooth transition to cold. Now, there are a lot of people out there that just don't care. They can put the ice on, no big deal. And my hat's off to you. I could never do that. Okay. The length of time is very important. You want to do it 15 to 20 minutes. Any less than 15, you're not getting the full benefit that you could be receiving from the ice. Any more than 20, and your body is actually going to start compensating by bringing blood to the area and kind of undoing all the good that you did during the icing. So, my suggestion, if you like watching TV, start at the top of a show, put the ice bag on. There's a commercial somewhere between 15 and 20 minutes after the hour. Take the ice bag, get it in the freezer. Then at the top of the next hour, when the show starts again, the next show starts, put your ice back on. Another thing is, multiple times of ice is very good. So let's say you've got an hour and a half before you have to be someplace. Put the ice on. Take it off. That's your first hour. Put your ice back on again. 20 minutes later, take it off. You've got to go, just go. You don't have to wait the last 45 minutes doing nothing. You can just take off and go. So those are some quick do's and don'ts to icing. Very important. Huge, great if you do it right. I suggest personally, do not put the cold right on after the ice. Not a big fan of that. I know a lot of physical therapists like that. Not my idea of the best that you can do. Decide what you want to do, what works best for your body. It's up to you. That's it for this episode of Ask Dr. Jack. I'm looking for any emails that you have. Remember, the email address is askdrjackbee@gmail.com. Send me those. Call up the office. Stop in and see me as a patient. I will get the questions. I'll get you the answers. Have a great day.